Our teams are amazing.
They're dedicated in a way like nothing I've ever seen.
My patients are the reason that I do this job.
My patients are gifts to me.
It's an honor to me. It's a sacred piece of work, and I love it.
It was like God was saying, I put this person here, I put this person here, I put this person here. Don't worry.
Palliative care, it's about helping ease the symptoms and enhance the life of people living with serious illness and their loved ones.
And it can be patients of any age, all the way from newborns all the way through the elderly.
While hospice care is a part of the end-of-life care, palliative care is really focusing on helping the person live the best life they can live right up until the end of that life.
And also, it helps people come to grips with what's really going on, so they may have questions. Is this treatment really going to help me? What are the odds?
I guess I thought palliative care was really an end-of-life, like last resort. We just help you die. And that's absolutely not what I found. I found the opposite, which is we want to help you live, and we want to help you live well.
I think we are ahead of the curve at this institution when it comes to palliative care.
Palliative care is just so integrated into the institution that I think we collaborate really well, and we do collaborate very closely with our colleagues. They call us in and they trust us, which is really amazing, and it doesn't happen everywhere in the country or in the world.
And we were actually the very first academic medical center in the country to be certified by the Joint Commission for Advanced Palliative Care.
And I think that the care that we can provide on 412 is so unique because we just take into consideration what the patients want and we do whatever we can to make that happen.
One of my favorite parts about palliative care, at least, is our ability to be an extra layer for people, whether it's a social worker, whether it's a nurse that someone connects with, that extra person for a patient, for a family member, to just be able to say, I can take a deep breath right now.
Our patients have a lot of complex needs, so you really need a team to take care of people best. Nobody can kind of encompass all of the important skills that are needed.
On 412, we hire nurses who are passionate about palliative care. You have to be drawn to this work to be able to do it day in and day out.
Well, I play my harp for them. The harp has been a therapeutic musician for centuries. I base what I'm going to play on the symptoms that I see. You can just sort of really assess what might be the sweet spot of music for that person.
It's more about what brings meaning to this person's life. What's their core? What gets them out of the bed?
In addition to taking care of our patients with a multidisciplinary team, we also have a strong emphasis on helping other clinicians who are not palliative care specialists do the palliative care stuff.
Our palliative care team has been very helpful in helping us better communicate with our patients.
I'm focused on getting the treatment in. They can open my eyes to things that I'm not seeing or symptoms that I'm not really managing. And then I learn from them too. So that sometimes then I can do it on my own. It's just very useful. It's teaching for me, it's teaching for the patient.
Education is extremely important here at the university, and we spend a lot of time interacting with our residents and our fellows and medical students as well.
We want to create a center without borders, and we want to create a network where it is easy for somebody in the School of Nursing to connect with somebody in the School of Medicine if they have a shared interest or a common project. And we also want to make it as easy as possible for people to find the resources that they need to succeed in palliative care research.
I've just seen people have amazing interactions and a sense of peace and calm, and it's truly an honor and privilege to be part of that and to help families and loved ones come together at such a special time.
People will often say, gosh, that sounds like it's really hard work. And yes, it's really hard work and it's deeply gratifying. You can see I'm enthusiastic about this because I know I can deliver on our promise to help make a difficult situation better.
It's a privilege to serve in some of the most difficult moments in a child's life, and to be able to help make it even just a little bit easier
It's an extraordinary gift.
We become part of their story, and their stories become part of us. And we really are able to share that with our patients in a way that I think is really special. It can sometimes be very difficult, but ultimately it's rewarding, and I think keeps us all going.